If you read clinical literature, you would have come across a measurement called the p-value. These p-values are cited in a lot of literature usually to prove that a new drug or treatment is more effective or similar to an existing drug or treatment. So what are these p-values and how do they help us? Hi, my name is Atanu, and in this video, I'm going to talk about p-values, how and how not to interpret them. So the p-value is a statistical measurement and it is used in what is known as a test of hypothesis. So let's take an example. Suppose we have a new diabetic control drug, or we want to find out whether this new drug is better than an existing drug. To do that, we need what is called as a p-value. To find out a p-value, we first have to formulate two hypotheses. The first hypothesis, known as the null hypothesis, assumes that there is no difference in the effect of the new drug and the old drug. And the other hypothesis, called the alternate hypothesis, assumes that there is a difference between the old and the new drug. So to calculate the p-value, we need certain data, and to collect this data, we conduct a trial or a study. So we take 100 subjects, diabetic patients, and we divide them into two groups of 50 each. So we give the old drug to one group and the new drug to the other group. We calculate the average blood sugar levels at the beginning of the study and at the end of 6 months for both the groups. We find that blood glucose levels of the new drug has come down by 20 units and that of the old drug has come down by 8 units. So there is a difference between the effect of the old drug and the new drug of 12 units, which we call the effect size. So can we now claim that the new drug is better than the old drug? To find out, we have to calculate the p-value. The p-value is calculated using a statistical tool, typically a t-statistic. It depends on the effect size, on the sample size and a variation in data. It is a common practice to say that if the p-value is less than 0.05, then we reject the null hypothesis. Let's say in this case the p-value is 0.04. That means we have sufficient evidence to reject the null hypothesis, which in turn means that the difference in the effect of the new drug and the old drug is not by chance alone, and that this difference is statistically significant. On the other hand, if for example the p-value is let's say 0.4, which is more than 0.05, then we say that there is not enough evidence to reject the null hypothesis. So now can we convincingly claim that the new drug is better than the old drug? The answer is no. To do that, first thing we need is a repetition of the trials. We need several trials to prove that the p-values are consistently lower. Number two is that we need to cite the exact p-value. The lower the p-value, the greater is the evidence for rejecting the null hypothesis. The third and most important thing is that we should also cite the confidence limits while citing the p-value. For example, if the p-value is 0.04, but the effect size varies between let's say 1 and 30, then that is not an impressive effect size. So I hope you like this video and it has been useful to you. If you like it, please leave a comment and pass it in your network. And I'll see you in the next video. Bye for now.